Hi guys, welcome to this next session where we'll be talking about absorption. Absorption, we have already seen the basics of absorption already. So what exactly is that? Movement of drug molecules from the site of administration to the blood, which means here we're talking about pharmacokinetics, and that is nothing but how the drug is going to cross the biomembranes. How it is going to cross the biomembranes, and that's what we're going to talk about right now. The movement across biomembranes can be of two different types based on the individual molecules which we give. A molecule might be either a large one or a molecule might be a smaller one. If it is a large molecule, how it is going to be crossing that? Simpler. We have the cell. This large molecule is going to be endocytosed. It is going to be moving inside the cell and it is going to get exocytosed out from the cell. A simpler basic, and to say a very common one which is being used for neurotransmitters. Long ago it's been used since times for neurotransmitter release. Now what about smaller molecules, guys? For smaller molecules we have three major routes by which a drug molecule can cross biomembranes. The first one is passive diffusion, we have facilitated diffusion, and we have active transport. So consider here is I have a tea here and I have which has been tea bag is been put up. What normally, how do we drink it, guys? We just put a hot water in it. You just take a tea bag, put it up, you just keep it aside, wait for some time, and after that you drink it. What has happened till now? Passive diffusion has happened, which means the tea molecules which is there inside the tea bag has been put up in that hot water, and the tea molecules is slowly moving out from the membrane, right? We have a tissue paper which is the membrane actually. The tea molecule is going to be slowly moving out from the membrane and it is going to be mixing up with the water. So at one point of time it reaches an equilibrium, right? And after that there is going to be no movement of tea molecules and the tea is normal and you just drink it. This is what happens whenever we are talking about a passive diffusion. What about the next one? The next one we have some people, they'll be doing this. Right, so we will be having the tea bag and they will be constantly doing this while talking. And why? Because they want the movement, to say they want more strongness in the tea which they are drinking. Right. So what we are actually picking up this tea bag and we are slowly shaking it up so that the tea molecules is going to be moving out from inside towards outside, which means we are facilitating the diffusion. This is the second method. And the third method is, even after doing all these things, if the tea is not concentrated or stronger enough, some people will take up this tea bag, put it up in the walls of the cup and will try to squeeze it out. Right? When they try to squeeze it out, what will happen? We are inducing energy to force out the molecule from the tea bag towards outside. Clear? And the third one is called as active transport. So simply put, as this table explains, the passive diffusion, what we are going to see, there is movement of drug molecules from the concentrated area towards a dilute area, right? A tea bag, inside the tea bag, the tea molecules is concentrated. It is moving out from a higher concentration towards the lower concentration, which means the gradient here is towards down, right? The molecule is moving from a higher concentration towards lower concentration. What about facilitated diffusion? The same thing happens, right? The same thing has happened, but we are facilitating the diffusion which is already happening. The movement is again down the gradient. And the last one, there is equilibrium. The equilibrium has been attained. The molecule level, the concentration inside the tea bag and the concentration in the water is equal. But yet we try to squeeze the molecule out from the tea bag so that we can get more concentration out of it. Which means here the concentration is against the gradient. Here the movement is against the normal gradient. What about carrier molecules? For passive diffusion, I have not used any of the carrier molecules, but for facilitated diffusion, I use a carrier molecule. Clear? And for active transport, I use a carrier molecule. Here, the carrier molecule is my hands here. Right? For passive diffusion, I don't use any carrier molecules. For facilitated diffusion, I use a carrier molecule. And for active transport also, I use a carrier molecule. What about energy? For passive diffusion, no need for any energy. For facilitated diffusion, no need for any energy. But for active transport, I use energy to push the molecule out from inside the tea bag towards outside. This is what exactly the difference between the three major types with which a molecule can be moving out or moving out from the site of administration. So among this, we have this facilitated diffusion. We have certain classical examples of this facilitated diffusion, which is majority seen in your physiology itself, guys. The GLUT transporters, GLUT transporters, And we have SLC molecules, solute carrier molecules. These two are classical examples of facilitated diffusion. Whereas active transport might be of two different types. It might be primary or secondary. Primary can be either P glycoproteins, we used to call them as P glycoproteins. We have MDR type 1, multi-drug resistance type 1 protein, it's a type of an active transport. We have BCRP and we have efflux pumps. These are different pumps which are examples of primary active transport. Secondary active transport, we have organic acid transporter, organic base transporter. We have norepinephrine transporter, serotonin transporter, dopamine transporter. Then we have vesicular monoamine transporter, the VMAT molecules. Then we have SGLT type 1, SGLT type 2, sodium glucose transporter type 1 and 2. All these are secondary active transport molecules. So, simply put, as we can see in this diagram where the movement of molecules has been clearly depicted. Here is where the cell is and here is where the blood vessel is. The drug molecule from the cell, or to say from the intestines or from the site of administration, is going to be crossing the membrane, is going to be crossing the blood vessel wall and gaining entry into the blood directly from an area of higher concentration towards lower concentration, which will be called as passive diffusion. The next one, the same drug molecule inside the cell is going to move into the blood, but not via direct methods, with the help of a transporter there. And this transporter is responsible for this movement of molecules from an area of higher concentration towards an area of a lower concentration. This is what we call it as facilitated diffusion. And on the same time, the same drug molecule is going to be moving from the cell and it is going to move into the blood. But for this movement, we need energy molecules, and that is ATP molecules is going to be necessary. When ATP is being utilized, this movement will be called as active transport.